Why do some nursing students regress and insist on being spoon-fed content in order to pass the test? Today's topic, stop spoon-feeding adult learners. Strategies to get students to come to class prepared. Now, I'm not being denigrating in any way to students. This is a common description when I go to talk to educators. They have a problem, and it's students who insist on being spoon-fed, but it's complicated, and it's not always to blame on the students. There's a problem that educators have in this equation, is that they basically give students too much information, and they get stressed out as a result. And you know what that happens whenever anybody's stressed? They regress. And that's the challenge. If you're to look at what students communicate to me, they have stated this in writing. In my class, it's information overload, unrealistic reading expectations. We are rushed covering huge amount of content in a small amount of time. And these struggles that students experience are not unusual. And I want to address this from both perspectives, because as educators, we can do things differently. We can transform the way we teach to quit stressing our students out and strengthen their student learning. How do we do it? Eliminate infobesity. Look at this student, and is she not typical of most students in nursing education? Look at her pleading eyes. She is stressed, she's overwhelmed, and she's pleading with you as an educator, help. I am swimming and I am drowning in thousands of pages of textbook readings. Now, the problem with infobesity is simple. You can only know so much. And if we expect too much, if we're covering so much content in our lectures, in our PowerPoints, and in our readings, they get a skin-deep, superficial knowledge, but they don't get the deep learning of what is most important. And so when you look at what do we want to focus on, if we're a nurse educator, let's really remember who we're teaching. And let's focus our content on some areas. Number one, what's common to practice? There are some problems your students will not see for decades in practice, like myasthenia gravis. Let it go, and let's focus on the most common problems in our concept or our body system. What's relevant to practice? And again, this is very similar to common, but what's really most relevant? What's most important? Let's drill deep on that. Let's remember we're teaching first-year generalist nurses, not specialists. Keep it simple to a generalist level of practice. And remember that relevance equals retention. So let's keep it simple and let's keep it relevant relating to our content. But let's not forget this. Both students and educators have a balance in this equation. Educators have a responsibility to teach well. Students have a responsibility to learn, and this seesaw is the middle. It's a 50-50, and students must do their part to come to class prepared, doing their part to be not just a sponge and an absorber of knowledge, but one who is engaging and wanting and having a thirst to be the best and not just good enough to pass the test. So, and as it relates to students, let's help them remember that classroom is no different than clinical. Therefore, you need to come prepared. Communicate the rationale for best practices and what that looks like. Practicing the nurse thinking in this classroom. Active learning, that's not busy work. And let's remember that it's all about application of knowledge to prepare for practice, not simply regurgitating information to pass the test. So how do we change this paradigm? A ticket to class. I want to encourage you as educators to kind of wean your students from being spoon-fed by giving them an assignment. I have a one-page handout I'm going to share with you briefly on pathophysiology. Help your students drill deep in understanding pathophysiology by asking just these questions. What if of the primary problem that you're teaching, what's the pathophys of this problem in your own words? And how would you teach this problem to your patient, among others? There's 4 others. Get the worksheet. There's the link in the description. But the bottom line is use this tool to help your students get the essence of what is most important. Come to class prepared and engage them in meaningful active learning. So what was your big takeaway? What will be your next step, whether you're a student or a nurse educator? If you found this content helpful, be sure to subscribe to my YouTube channel, Think Like a Nurse, and share this video with others. Go deeper on this topic and receive contact hours inside my membership for educators that provides innovative tools and essential teaching to transform the way you teach so your students graduate better prepared for practice and licensure. Thanks for watching.